When we observe how migraine manifests across the lifespan, it can be different from childhood through adulthood and into the elderly. And when we focus on those over age 60, some notable differences may include that the headache aspect of migraine attacks may start to fade into the background, and aura-like symptoms may begin to predominate. In fact, in some individuals, these late life equivalents of migraine, where aura is the only manifestation, can occur. And this is often confused with transient ischemic attacks. But most people with migraine who are above age 60 have had the disease for decades. And like many people who live with migraine, they observe that it can change and evolve in its characteristics over time. For people over the age of 60, they're more likely to have other medical comorbidities, which may limit the treatment options that we can offer them. Most notably, cardiovascular disease and cerebrovascular disease starts to increase in prevalence in this age group. And because some treatments for migraine, most notably the triptans and the ergots, may cause vasoconstriction, this may not be a good option or may be outright contraindicated in this group. When we speak about preventive therapy, although we do use certain antihypertensive medications for prevention, they may not be suitable for one reason or another, again, with respect to cardiovascular health in this age group. And for the better of their cardiovascular health, a different antihypertensive may be desired, and it may be one that has no positive benefit for migraine, meaning that we have to add yet more medications to the load of somebody who's already dealing with multiple medications. Well, we have data focusing just on those over age 60 who were treated across 3 different trials of fremanezumab, the HALO and the FOCUS trials. And this consisted of nearly 300 individuals over the age of 60. We also have data for participants of any age who may have cardiovascular risk factors, and that number is close to 500, including some individuals over age 60. And we're happy to report that among those groups, we don't see major differences with respect to responses to fremanezumab or the tolerability or the safety of the treatment. So that's very encouraging that fremanezumab can be offered to a broad range of patients, even those with difficult and challenging cases. When we look at pooled analyses of patients over age 60 or those who have cardiovascular risk factors, we see results which are very similar to the entire cohort of participants who were studied in the HALO trials and the FOCUS trials. We're seeing reductions of 4 to 5 days per month of migraine or headache of at least moderate severity compared to about 2 to 3 days in placebo. And these numbers are similar in this age group, those with risk factors, and the entire cohort combined. We also see that there are reductions in days where acute medication is needed to treat migraine attacks. And the benchmark of 50% improvement in frequency hits around 35 to 40% for those on treatment compared to 20 to 25% on placebo. And those numbers are similar to the entire cohort across the fremanezumab trials. And then with respect to safety, even among individuals who have cardiovascular risk factors, the adverse event reporting is not much different when you compare it to the entire cohort. And what predominates with respect to cardiovascular risk factors are high blood pressure, palpitations, and increased heart rate. These occur at low frequencies, less than 2% in the entire cohort, and around 4 to 6% at most in select subgroups of participants of this age or who have cardiovascular risk factors. And these adverse events are overshadowed by the most common adverse event among the clinical trials, which is injection site reaction. Many older patients with migraine, like patients of any age with migraine, may benefit from a treatment like fremanezumab. And those who would be ideal candidates would be patients who have already experienced treatment failures from standard approaches, patients who are already on a lot of medications and wish to avoid medication interactions, patients who desire a treatment which has a favorable side effect profile, like fremanezumab, and patients who really need relief. Those who are significantly burdened by their disease, it interferes with their day-to-day functioning, it impairs their quality of life, and may even pose some risks and challenges with respect to managing their acute attacks. For example, because many older patients cannot use triptans, they may have to use anti-inflammatory drugs, which can carry their own risks. So what we need to do is to reduce disease burden over time, and fremanezumab can be a key player in that plan.